In this video, I'll be addressing the side effects of Viagra or Sildenafil and strategies to mitigate them. The most frequent issues you may encounter include vertigo, migraine, flushing, and gastrointestinal discomfort. Changes in vision, such as heightened sensitivity to light or altered color perception, may also occur. Should any of these effects persist or worsen, it's crucial to inform your doctor promptly. Combining sildenafil with nitrate medication can lead to a sudden and severe drop in blood pressure. Typically, these medications are taken 30 minutes to an hour before engaging in sexual activity. While there are numerous side effects like chest pain, blood pressure fluctuations, stomach ulcers, and liver or kidney complications, two concerns require immediate medical attention when using sildenafil. Firstly, if you experience a painful erection lasting over 4 hours, known as priapism, it could result in penile damage. Applying ice packs to the affected area may offer temporary relief. Secondly, sudden vision loss warrants urgent medical evaluation. Note that excessive alcohol consumption post-Viagra ingestion could compromise efficacy and exacerbate hypotensive effects. Additionally, sudden urinary loss, accompanied by ringing in the ears and dizziness, may occur rarely. Cease sildenafil intake and seek immediate medical assistance if you observe these side effects. Should you experience cloudy or bloody urine, increased urination frequency, or discomfort while urinating, medical attention is warranted. Other common complaints include back pain, myalgia, sinusitis, rhinitis, pharyngitis, and dry eyes. Now, let's delve into some other medications that may interact with sildenafil. If you're also taking alpha blocker medications such as doxazosin or tamsuline to treat an enlarged prostate or high blood pressure, your blood pressure may drop too low, leading to dizziness or fainting. Additionally, certain antifungal, antibiotic, and antiviral medications can interact with sildenafil, so it's essential to consult your doctor before taking sildenafil if you're already on other medications. There are certain conditions when you should strictly avoid this medicine, including a history of allergy or painful erections. Erectile dysfunction, ED, is a common problem, but 95% of cases are treatable. Exploring various treatment options with your doctor could potentially be life-changing for many individuals and their partners. Let us know in the comments if you're interested in more content on ED or any other topics. Don't forget to subscribe and hit the notification bell to stay updated on our latest videos. Thank you.